Most people over 50 worry about one big question. Will my money last? But there is one retirement expense that quietly changes the answer for millions of people. Healthcare. Not because people ignore it completely. Most people know healthcare will cost something. The real problem is that they underestimate where the costs actually come from. They think Medicare will cover more than it does. They think a monthly premium is the whole bill. They think a healthy lifestyle means they can plan for average costs. And then retirement begins. A dental bill appears. A prescription changes. A premium goes up. A hearing problem becomes expensive. A family member needs help at home. And suddenly, the retirement plan that looked safe on paper starts to feel much weaker in real life. Today, we are going to look at 5 hidden healthcare costs that can quietly drain your retirement savings. Not to scare you, but to help you see the cracks before they become expensive. The first hidden cost is the cost people forget because they think Medicare means covered. Medicare is important. But Medicare is not free healthcare. That one misunderstanding can create a dangerous blind spot. There can be premiums. There can be deductibles. There can be copays. There can be coinsurance. There can be out-of-pocket costs that show up again and again. Imagine a woman named Linda. She is 64, careful with money, and planning to retire at 65. She has a 401k, a small emergency fund, and a Social Security estimate that makes her feel reasonably comfortable. In her mind, the retirement budget is simple. Housing. Food. Utilities. Insurance. A little travel. A little help for the grandkids. But when she builds her budget, she writes one small line for healthcare. Medicare. That is the mistake. Because Medicare is not one single number. It is a system with parts, premiums, deductibles, plans, drug coverage, and choices. In scenario A, Linda looks at healthcare as a separate retirement category. She asks what her monthly premiums could be. She checks deductibles. She looks at drug coverage. She leaves room in her budget for out-of-pocket costs. In scenario B, she simply assumes Medicare will take care of most things. At first, both versions of Linda may look fine. But 5 years later, scenario B is the one under pressure. Not because Linda was reckless. Because the healthcare line in her budget was too small. That is how healthcare drains retirement savings. Not always through one giant bill. Sometimes through 100 smaller costs that were never truly planned for. The second hidden cost is dental, vision, and hearing. This is one of the biggest shocks for retirees. Because these are not luxury problems. They are basic quality of life problems. A tooth breaks. A crown is needed. Glasses need replacing. Hearing starts to fade. A person avoids restaurants, phone calls, and family conversations because they cannot hear clearly anymore. These are not small things. But many people are surprised to learn that original Medicare does not cover many routine dental, vision, and hearing needs the way they expected. And that surprise can be expensive. Imagine Robert, age 67. He retires thinking his biggest healthcare costs will be doctor visits and medication. Then the dentist tells him he needs major work. Not cosmetic work. Necessary work. The kind of work that affects eating, sleep, pain, and confidence. He did not budget for it. So now he faces a choice. Use savings. Put it on a credit card. Delay treatment. Or pull money from a retirement account earlier than planned. That is the trap. A healthcare cost becomes a retirement income decision. In scenario A, Robert planned for dental, vision, and hearing as separate categories. He knew they might not be fully covered. He kept a healthcare reserve for these, not quite medical, but still necessary, costs. In scenario B, he assumed his health coverage would handle the basics. The difference is not just money. It is stress. It is dignity. It is the feeling of being prepared versus feeling blindsided. And after 50, being blindsided is expensive. The third hidden healthcare cost is prescription drug surprises. Many people think the risk is only about taking a lot of medication. But sometimes the risk is change. A medication you take today may be affordable. Then the dosage changes. A new prescription is added. A drug moves tiers. A plan changes its formulary. A pharmacy price changes. Or a medication that seemed manageable becomes a real monthly burden. This is especially dangerous because prescription costs can become recurring costs. Not a one-time emergency. A monthly leak. And monthly leaks are the ones that slowly weaken a retirement plan. Imagine Elaine, 70 years old. She is careful. She does not overspend. She cooks at home. She tracks her bills. Then one of her prescriptions changes. The cost is not enough to ruin her in 1 month. But it is enough to change the budget. So she starts moving money around. A little less saved for property taxes. A little less set aside for car repairs. A little more pressure on the credit card. A little more fear every time she picks up the prescription. That is how retirement stress grows. Small changes become permanent costs. In scenario A, Elaine reviews her drug plan each year. She checks whether her prescriptions are covered. She asks what her out-of-pocket costs may look like. She does not assume last year's plan is still the best plan. In scenario B, she keeps everything the same because it feels easier. One person is managing a system. The other is hoping the system does not change. And hope is not a healthcare plan. The fourth hidden cost is the Medicare income trap. This one surprises people because it does not always look like a healthcare decision. Sometimes it starts as a tax decision. A Roth conversion. A large IRA withdrawal. A capital gain from selling an investment. Extra income from part-time work. A required withdrawal later in retirement. Then the retiree discovers that higher income can affect Medicare costs. That is when healthcare and taxes start talking to each other. And that conversation can get expensive. Imagine David, age 68. He decides to withdraw extra money from his IRA to renovate the kitchen and pay off a car. It feels responsible. No debt. No monthly payment. A cleaner financial life. But that withdrawal increases his taxable income. And when income rises, other costs may change too. He thought he was solving one problem. But he may have created another. This is why retirement planning after 50 cannot be done in separate boxes. Healthcare is not separate from taxes. Taxes are not separate from withdrawals. Withdrawals are not separate from Medicare. They all connect. In scenario A, David checks the income impact before taking a large withdrawal. He asks whether spreading the withdrawal over time could reduce pressure. He looks at the tax year before he moves the money. In scenario B, he takes the money first and learns the consequences later. That is a dangerous order. Because after retirement, mistakes do not always show up immediately. Sometimes they arrive months later in a letter, a premium, a tax bill, or a benefit change. That delay is what makes the mistake so easy to miss. The fifth hidden cost is long-term care. This is the one many families do not want to talk about. And because they do not talk about it, they do not plan for it. But retirement does not only require money for doctor visits. Sometimes it requires help. Help bathing. Help dressing. Help eating. Help moving safely. Help at home. Help in a facility. Help after a fall, a stroke, an illness, or a slow decline. Many people assume Medicare will take care of long-term care. But that assumption can be devastating. Medicare may cover certain skilled care in specific situations, but long-term custodial care is a different issue. And when families discover that difference too late, the financial pressure can be enormous. Imagine a couple, Mark and Susan. They are not wealthy, but they did things right. They saved. They paid down debt. They delayed some spending. They entered retirement with a sense of calm. Then Susan's mother needs daily help. At first, it is just a few hours. Then it becomes more. Then family members start missing work. Then someone needs to pay for care. Now the retirement plan is not just supporting two people. It is supporting a crisis. And no one planned for it. In scenario A, Mark and Susan had the conversation early. They looked at long-term care options. They discussed family roles. They understood what insurance may or may not cover. They did not have every answer, but they had a plan. In scenario B, they waited until the need arrived. By then, every choice felt urgent. And urgent choices are usually more expensive. This is the deeper lesson. Healthcare costs do not drain retirement savings only because medical care is expensive. They drain retirement savings because they appear in places people did not expect. Premiums. Dental work. Vision needs. Hearing aids. Drug costs. Income-related Medicare costs. Long-term care. Each one can look manageable alone. But together, they can quietly reshape retirement. That is why people over 50 need to stop asking only, "How much do I need to retire?" They also need to ask, "What healthcare costs am I not seeing yet?" Because the dangerous cost is not always the largest one. Sometimes it is the one missing from the plan. The line you forgot to add. The assumption you never questioned. The expense that felt too uncomfortable to discuss. And if you are over 50, this is the time to look at it clearly. Not later. Not after the first big bill. Not after retirement begins. Now. Look at Medicare beyond the premium. Plan separately for dental, vision, and hearing. Review prescription drug coverage. Understand how income can affect Medicare costs. Have the long-term care conversation before your family is forced into it. You do not need to solve everything today. But you do need to stop pretending healthcare is one simple line in your retirement budget. Because retirement is not protected by optimism. It is protected by preparation. And the people who prepare for hidden healthcare costs are often the people who feel more control when retirement becomes real. If you are over 50 and want to avoid the retirement traps most people discover too late, subscribe to Money After 50. This channel helps you understand the money decisions that can protect your income, your savings, and your retirement before life gets expensive. This video is for educational purposes only and does not provide financial, tax, legal, or investment advice. Always consult a qualified professional before making financial decisions.